Introduction to pathology. What is pathology? Actually, when we use this term pathology or anyone call this term pathology, immediately our mind divert to just on the blood samples and urine and just pathological or pathology center. Okay, but it's not only pathology. Pathology is a different thing. This pathology labs are also include or involve. Okay. But pathology means patho means the term pathology is a mixture or of two words. One is patho and second is logy. And these terms are Latin term. Okay. Patho means patho means disease and logy means study. So where we study of studies of disease, that is called pathology. So the scientific study of the disease is called pathology. So and the pathology focus on the structural, biochemical, and functional changes in the cell. Cell is the smallest unit of the body. Every disease is because of the cell, or every medicine works on the cell. No? Cell is the smallest unit of the body. In pathology, we focused on structural, biochemical, and functional changes in the cell or in the tissue or in the organ. What is the functional changes? Sorry, structural changes. Structural changes means banawat or structure of a cell, and structural changes may be because of the inflammations and infections. Then biochemical changes means the chemical constituent of the cell change. Some chemical become more and some chemical become less. The proportion of the chemicals will be changed, and that changes are biochemical changes. And functional changes. What is the functional changes? When the chemical changes there is change in the in biochemicals of the cell, then the function of the cell will be changed. In this branch of medical, we study the logic of disease, means pathological study, scientific study of the disease. Vani, please.
Oh, sorry, sir. Sorry, sir. Oh, yeah.
And branches of pathology. we divided it into the two parts. One is general pathology, and second one is systematic pathology. General pathology is connected with the basic reactions of the cell, tissue, and abnormal stimuli that underlie all the diseases. And systematic pathology means uh, organs pathology or a system pathology. Examine the specific response of specialized organ and tissue to more or less well defined stimuli. So, for this purpose, we use these techniques: molecular level and microbiological studies, immunological studies, and morphological studies. So, here is an example I put on this screen that the height of a person, of a human, is day by day decreasing. The height of a human is day by day decreasing. Why it is decreasing? So the patient's own fault or the effect of outside agents, disease or any effects depend on our two things. Okay. One is our own level, and second one is outside level, like outside agents such as bad smell, cold, evil spirits. Okay, so you can divide it in two factors. Okay. That factor is called etiologic factor. One is genetic, and second one is acquired. Genetic means the factor which we transferred from our parents, and acquired means the factor which we receive or acquire from the outside or atmosphere. So the disease process is first etiology, second pathogenesis, third one is molecular and morphological changes, then clinical manifestation. Patient comes in the fourth stage. That stage is the clinical manifestation. Okay. So, what is the etiology of disease? We divide etiology of the disease in two parts. Etiology of disease means what is the cause of disease? What is the cause of the disease? Okay. If the cause of the disease is known, that is called primary etiology. If cause of the disease is unknown cause, that is called idiopathic etiology. There are two major classes of etiologic factors. Number one, genetic and acquired. Genetic transfer from the parents. Acquired means infections, nutritional, chemical, and physical. Pathogenesis means the mechanism through which the cause operates to produce the pathological and clinical manifestation or structural and functional abnormalities. So the incubation period, the time between the exposure to the virus or bacteria or any disease and the appearance of the symptoms. Okay. Just you can take an example earlier in the COVID. After the exposure of the virus, the COVID symptoms was appearing after 3, 4, or 5 days. That's why they was quarantine for the 14 days like that. Just the reason of the quarantine in the COVID period, the suspected people, maybe the exposure of virus, so that was the suspected people, and he was quarantined to suspected persons because of the incubation period only. We are quarantined for 14 days. 14 days was the maximum incubation period of that virus. So after this incubation period, there is appearance of the symptoms. Then morphological changes. Morphological changes means the changing in the structures or alteration in the cell, or not required to repeat it again and again. Cells makes the tissue and tissue makes the organ. Okay. So alteration in the cells that occur following pathogenic mechanism. Okay. The structural changes in the organ or cell can be seen with a naked eye, or they may only be seen under the microscope. Some structural or morphological changes we can see with the naked eye. For example, some kind of cyst, some kind of the lipoma, or some other changes we can see with the naked eye. But some changes we can see with the microscope. Gross morphological changes and microscopic changes. Here it is an example of clinical manifestation. When the morphological changes in the organ influence the normal function of the organ. When the morphological changes in the organ or cell, then it's influence to the normal function of the organ. For example, sneezing, whooping cough. So before sneezing, there are morphological changes in this nasal area cells. There may be some inflammation, sinusitis like that. Then due to this, we are sneezing. By doing that, determine the clinical features, symptoms, and signs, okay, course and prognosis of the disease. So in summary, pathology studies etiology, pathogenesis, morphological changes, then clinical features and prognosis. When patient will come to you on clinical features level. There is an example of cellular level, cellular response to the stress and toxin. Okay. So daily, our cells are they are daily parity of our cells dead daily. Okay, it may be because of the stress. Actually, stress kills our cell. Okay, and some sometimes some direct injury of the cell. Okay, so due to the stress, there is adaptation. Okay, and finally the cell injury. Okay, cell injury. There are two type of cell injury. One is the mild transient, and second is the severe. Okay. So mild transient, severe progressive. The if the cell injury is mild transient, then it reverse and it recovered by our body, and it will form reform to the normal cell. And in the severe injury, severe progressive, yeah, severe progressive is the irreversible injury, and that irreversible injury is called necrosis or apoptosis. That is called cell death. Cell injury and cell death. So, what the cell injury? If the cell fail to adapt under stress, fail to adapt under stress, they undergo certain changes that is called cell injury. And reversible and irreversible cell injury, the effect cells may recover from the injury that is called reversible injury, recycle, okay, or maintain, repair, okay, or some cells die as a irreversible changes. Okay. So dead cell, the cell which is dead as the on the biochemical level, that cell will not be reversible. So what is the cause of cell injury? What is the cause of cell injury? Cell injury, the cause of the cell injury is the two types of the cause. One cause is the genetic, means some DNA level or RNA level changes in the body, which we collect or transferred from our parents. And second one is acquired. Okay. Acquired cause means it may be some infections, bacteria, virus, or sometime some physical cause. So in genetic, there are developmental injury, cytogenic injury, and single gene injury. Okay. And in the acquired cause, there are low quantity of the oxygen, physical agents, chemical agents, infections, immunologic reactions, and genetic derangements, and nutritional imbalancement of the body. Okay. So, first the cell injury is acquired cell injury is low level of the oxygen in the body, because cell require the oxygen. Without oxygen, cell can't survive. Okay, And the low quantity of the oxygen is called deficiency of the oxygen, or you can say it is the hypoxia. Hypoxia means low oxygen in the body. Okay. When the oxygen level is low in the body, it causes by reducing the aerobic oxidative respiration. What is aerobic oxidative respiration? The aerobic oxidative respiration uh, is a reaction, aerobic reaction of the cell. Okay. So hypoxia is an extremely important and common cause of the cell injury and cell death. So first, that's why the vitals, first we check the oxygen level of the body. If oxygen level of the body is low, so definitely the cell death will be start, or cell injury, not cell death, sorry, cell injury will start. So cause of the hypoxia, what is the cause of the hypoxia? Maybe due to the these causes. One is cardiorespiratory failure, means if there are low breathness in the body, and second is the decreased oxygen or carrying capacity of the blood, and third one is anemia, means low quantity of the blood in body, because our RBCs are the hemoglobin or RBCs are the oxygen. And next is physical agents. Physical agents means, for example, if we are doing some work or some cut or some hurt in our finger or in our body or in some accident, so that is called mechanical, maybe mechanical trauma. Okay. It may be a cause of cell injury. And next cause is physical agents. Next cause is the extreme of temperature, and third one is the radiation. And next cause of cell injury is chemical agents or some drug, some alcohol, or some poison such as arsenic and cyanide, mercury, salt may be destroy or sufficient number of the cell within minutes or hours to cause the death. Other potentially injury substances as air pollutions and insecticides and herbicides, industrial and occupational hazards such as carbon monoxide and asbestos, and drug, alcohol, and the ever increasing variety of therapeutic drugs. So, pollution injured our cells. Drugs like a chemical agent injury. Next is the infection agent. Infection agents are uh, Escherichia, bacteria, fungus, virus, and higher forms of the parasites. Third factor is immunologic reactions. That is the autoimmunity, hypersensitivity, And next is the genetic derangements. The disease may be result from the abnormal mutated genes or chromosomal abnormalities. And next is the nutritional imbalance. Because of the nutritional deficiency or sometimes because of the nutritional excessness, the injury of cell may be. So these are the cause of the cell injury. One is oxygen deprivation, physical agent, chemical agents, infection agents, immunological reactions, genetic derangements, and nutritional imbalances. And then next is morphological alterations in the cell. First was the etiological etiology injury of the cell. After the injury of the cell, there is morphologic alterations in the cell injury. Swelling of the cell and organelles, bleeding of the plasma membrane, deattachment of the ribosomes from the ER, and clumping the nuclear chromatin, loss of cell membrane integrity, defects in protein synthesis, cytoskeletal damage, or DNA damage. So then the reversible cell injury. The reversible cell injury are two types. One is acute or mild, maybe like cellular swelling, fatty changes, fatty liver, okay, because of the hypoxia. And cell death, for every cell, there is a time to live and a time to die. First, the function of the cell will be blocked or will disappear, but cell is live. After few hours or few minutes of the function disappearing, cell die. Clinical, so what is the clinical and biological death? Clinical death is when you are not feeling pulse, BP, and pupils are dilating, and person is not taking respiration, breath, no breath, then you declare that patient is dead. But that death is functional death. Biochemical death will take some time. After some time, the biochemical death will start, and functional death may be recovered. Okay. Many times you listen that that person died and after 5 minutes, 10 minutes, or 30 minutes, okay, he become alive. What is this? This is the functional death. The functional death may be reversible, but biochemical death is irreversible death. Biological death, biological death is irreversible death. So These irreversible cell injuries are persistent of excessive injury, and the result is the necrosis or apoptosis. Necrosis means the dead cell. You can see this example. Okay. Brown color part of the leaf is the dead part or necrosis part. In necrosis, what happened in the necrosis? Excess fluid enter the cell and inflame it, swell it, and ruptured its membrane, which kill it. After the cell has died, intracellular degradative reactions occur within a living organism. So this cell is because of the excess water. In an average adult human, between 50 billion and 70 billion cells die of and are replaced every day. But the necrosis refers to cell death that is unprogrammed and results from a typical body condition such as infections, cancer, serious injury, the presence of venom, and severe inflammation, and a variety of disease. So, what is the cause of the necrosis? Main cause of the necrosis is the hypoxia. Okay, in hypoxia, the nature of acidic of the cell will be more. The cell fluid will be more acidic, and as to because of the hypoxia means low quantity of the oxygen, so there will be more quantity of hydro H2SO4, hydrosulfuric acid, and this because of this hydrosulfuric acid, the cell membrane will burst or ruptured, and all the part of the cell came out, and it will not be reversible, and that is called necrosis. So necrosis is because of the hypoxia. If you see any necrosis patient, first try to for the increase the quantity of oxygen. Necrosis does not occur in dead organisms. Indeed, organism autolysis heterolysis take place. The brown Raculus spider whose bite can cause necrotic lesion up to 10 inches, 5 centimeters in diameter. Next is the morphology changes. Necrotic cells shows increased eosinophilia, have a more glassy homogeneous appearance than do normal cells, mainly as a result of the loss of glycogen particles. The cytoplasm becomes vacuolated and appears both eaten. Dead cells may be replicated by large myelin figures. The dead cells may ultimately become calcified. When you read some ultrasound reports, you will see that many times they use this term. There is a calcified cyst in kidney, there is calcified cyst in lungs. So, what meaning of this calcified? calcified cyst means that particular area, the dead cells, dead cells is called calcified cells. Calcified cyst means, and some people start to try to dissolve this calcified cyst. Calcified cyst you can't dissolve, and if the infection is stopped, and you can see this calcified cyst in lungs after tuberculosis. After tuberculosis treatment, you can see this calcified cyst. So, types of necrosis: coagulative necrosis, uh, liquefactive necrosis, fat necrosis, and caseous necrosis, gangrenous necrosis. Morphological pattern of necrosis. Coagulative necrosis is a type of accidental cell death, typically caused by ischemia or infraction. Coagulative necrosis is architecture of dead tissue is preserved for a last couple of days. You can see this image. Okay. This white color is the calcified cyst or dead cell. Liquefactive necrosis, which results in a transformation of the tissue into a liquid viscous mass. It is seen in the focal bacterial or occasionally functional infections. The necrotic material is frequently creamy yellow because of the presence of dead leukocytes, and it is called pus. What is the pus? Pus is a very cushion exam, sometimes MBBS exam. Okay. What is the leak? What is the pus? If any person asks you medically, sir, what is the pus? Pus is liquefactive necrosis. Means the dead cell with the liquid is called pus. Okay. For unknown reasons, hypoxic death or of the cell with the central nervous system often manifest a liquefied necrosis. Gangrenous necrosis. What is the gangrenous necrosis? It is usually applied to a limb, generally the lower leg, that lost its blood supply and has undergone necrosis. It is typically coagulative necrosis when bacterial infection is imposed. There is more liquefactive necrosis because of the action of degenerative enzymes in the bacteria, and the attract leukocytes give rise to so-called wet gangrene. Apoptosis. Apoptosis. It is type of cell death which help to eliminate unwanted cells and internally suicide program series of events affected by the dedicated gene products. Apoptosis is the death of single cell with the clusters of other cells. Apoptosis cells break up into the fragment called apoptotic bodies, which contain proteins of the cytoplasm and nucleus. The plasma membrane of the apoptotic cell and bodies remains intact, but its structure is altered in such a way that these become tasty targets for the phagocytes. When a cell is completed to commit suicide, the proteins called caspases go into the action. They break down the cellular components needed for the survival. Apoptosis is not followed by inflammation or calcification. Example, the resorption of the tadpole tail at the time of its metamorphosis into a frog occurs by apoptosis. The formation of the fingers and toes of the fetus require the removal by the apoptosis of the tissue between them. The clogging of the inner lining of the uterus at the start of menstruation occurs by the apoptosis. So apoptosis occurs normally both during the development and throughout the adulthood, and severs the eliminate unwanted age, potentially harmful cells. It is also pathologic event when disease cells become damaged behind repair and the eliminated. So apoptosis in the physiological situation during the development of removal of excess cells during the embryogenesis to maintain the cell population in the tissue with high turnover cells such as skin bowels and hormone dependent involution, endometrium, ovary, breast, etc., and elimination of the potentially harmful self-reactive lymphocytes. Apoptosis in pathologic situation is remove damaged cells by the virus to eliminate the cells with the DNA damage and radiation, cytotoxic agents, cell death in tumors. In the summary, cell death is the cell death necrosis type, M and N changes, apoptosis, PA and P situations and features. Next is the autophagy, in a process which a cell eats its own contents. Okay. What is the autophagy? Autophagy is the process. In autophagy, cell eats to its contents, especially in the long fasting period. This autophagy occurs. Okay, it is a survival mechanism in times of nutrients deprivation. In this process, intracellular organs and proteins of cytosol are first sequestered from the cytoplasm in an autophagic vacuole, which subsequently fishes the lysosome from an autophagosome, and the cellular components are digested by the lysosomal enzymes. And next is the intracellular accumulation. It is a cause of the morphological changes in the or structural changes in the cell. Okay. So, intracellular accumulation of the abnormal amount of the various substances due to the manifestation of the metabolic rearrangements in the cell. So, it may be normal cellular constituents like water, lipids, CHO, and abnormal substances, exogenous substances, and substance accumulate because the cell can neither degrade or the substance or nor the ability to transport it into other sites, minerals or products the infectious agent. Endogenous substances that cannot be metabolized because the deficiency of or defect of the enzyme and accumulate in the cell. Example, production of abnormal synthesis of metabolism. Next is chilosma, tan, burning or brown pigmentation commonly associated with the pregnancy or the use of oral contraceptives, also called the mask of pregnancy or melasma, and cetosis, fatty changes. The term cetosis and fatty changes describe abnormal accumulation of triglyceride within parenchymal cells, and which organs are involved and the cause. Especially the fatty changes often occurs in the liver, because liver is major organ, which organ is involved in the fat metabolism, but it also occurs in heart, muscles, and kidney. And disorder with hepatocyte damage. The cause of steatosis include toxins, proteins, malnutrition, alcohol, and anorexia. And disorder with hyperlipidemia, diabetes mellitus, and obesity. Assignment, protein, glycogen, pigments, hyaline changes, endogenous and exogenous constituents. Endogenous constituents which are inbuilt our body, and exogenous which we are adopting from outside of the body. So these are the cause of the cell structural changes, cell functional changes, cell chemical changes, or finally cell death. Okay. All the pathology is depend on the or working on the cell. Okay. So changes in the cell chemical, in the cell structure or cell morphology, and cell function is the disease. According to our system, or according to the five element concept, according to the electro-homeopathy, these changes of the cell is these changes of the cell or this steady state of the cell is maintained by these five organs. If these five organs are disturbed, then automatically there will be biochemical changes in the cell. When the biochemical changes occur in the cell, definitely the morphological changes will be there. Then the functional changes will be there. Functional changes is the symptoms of the patient. When patient come to you, they are the symptoms. So you should think about the story behind these symptoms. Okay. So for knowing this cause, these things behind these symptoms, okay, we study the pathology or we can diagnose it with the our five elements. So there is another thing with this pathology, okay, pathology of the cell. Now we try to find out that what is the cause of this changes. Basically, there are only the changes now, the chemical changes in the cell, and then morphological changes in the cell, then functional changes in the cell, or sometimes there is the death of the cell. So different changes of the different biochemical changes is because of the different part of the organ, and different biochemical changes shows different type of the symptoms. Okay, so which organ is involved in this particular biochemical changes in the body? We try to find out it by using these five elements. And in the modern system, we can find out these things by the hematology, means by the some test of the blood test. Okay, that is called some different type of the test, hematology, microbiology, some other test we will describe in next session. For the particular organ, there are some particular tests, like which chemicals produced by the liver, and what is the quantity of the presence of the these chemicals. The quantity in the presence of these chemicals are in uh, normal quantity, or are in less quantity, or are in more quantity. We can study this quantity with the blood test. Okay. So in next class, we will discuss a particular organ, for example, pathology of the blood, pathology of the liver, pathology of the kidney, pathology of the lungs, pathology of the spleen. Okay. So if you have any question related to today class, you can ask, because class is too lengthy.
What is the first kind of necrosis?
What is the
There are three you spoke of, three kinds of necrosis: liquefaction, gangrenous, and what is the other one?
Coagulative.
What?
Coagulative.
Coagulative. Okay. Thank you.
coagulative?
Okay, sir. Thank you.
Sir, will you share this PDF, sir, in group?
It's not PDF, it's PPT.
Yeah, sorry, sir, PPT.
What?
Yes, sir.
Sure, I will share, because I think without sharing this PPT, it is difficult to understand this session. No?
Yes, sir. So much information, sir. So,
After completing this class, I will share. If you want, I think PDF is more comfortable for mobile. Na?
what, sir?
PDF is more comfortable for the mobile.
This is in people
Irrespective
format,
to
sir.
PPT, PDF is more comfortable. Huh? Oh, no problem. I will convert it into the PDF and I will send it to you.
Okay, sir. Thank you, sir.
Any other question? Any other question?
Sir, what is the medicine you suggest for inflammation, sir? In our
For
remedy?
the inflammation, yes. Actually, in the today class, okay, you can understand that there are the many causes of the inflammation. Okay, inflammation is just only a stage of the disease of the cell. So we should try to understand. We should try to diagnose that what is the cause of this particular inflammation. What biochemical changes are there in the body?
Okay.
Normally, for the maximum inflammation, we drain out the water.
Hmm.
But after this today session, okay,
Hmm.
normally we can give acids or any medicine to drain the water.
Hmm.
Inflammation is a biochemical changes in the body, in the cell.
Hmm.
So these biochemical changes are because of our essential organs which are controlling or which are participating in the biochemical reactions.
Hmm.
For example, if you are making a if you are making a shikanji, I think you all are aware about the shikanji, na?
No.
So what the content of the shikanji? Content of the shikanji is lemon. Content of the shikanji is some salt, some sugar, and water.
Okay. Lemon juice.
All these four things are participating in making the shikanji. Na? Like
Yes,
that,
sir.
all our essential organ of the body is participating in the metabolism or metabolic reaction of the cell.
Hmm.
Simply, if there are low quantity of the oxygen, so low quantity of the oxygen is a main cause of the necrosis.
Hmm.
So now, who is the responsible for the low quantity of the oxygen? Hypoxia. It may be your lungs.
Hmm.
It may be your kidney.
Hmm.
It may be your liver.
Yeah.
For some time, it may be your heart.
Yes.
Lungs is directly producing to the oxygen. If your lungs is weak, definitely there will be low quantity of the oxygen in your body.
Hmm.
But if there is any kidney problem, okay, kidney produce the hormone for the hemoglobin production.
Yes, sir.
And hemoglobin carry to the oxygen.
Hmm.
If lungs are producing enough oxygen, but
Hmm.
hemoglobin is less,
Hmm. Hmm. Hmm.
and there will be hypoxia in the body.
Yes, yes.
So not only lungs is responsible here, your kidney is responsible, your liver is responsible, your spleen is responsible. If your heart is not circulating well, in that
Mhm.
condition, your heart is also responsible.
Yes.
So in the hypoxia cases,
Hmm.
how you can blame to any organ or any
Mhm.
single organ?
Mm.
You have to find out that this hypoxia is because of the lungs, because of the kidney, because of the liver, or because of the heart, or because of the spleen. Main symptoms of the hypoxia is, what is the main symptoms of the hypoxia? Main symptoms of the hypoxia is the breathlessness now.
Hmm.
Hmm?
Hmm.
Hmm? Breathlessness.
Yes, sir.
In some lungs related patient, you can see these symptoms.
Hmm.
In some kidney patient,
Hmm.
you can see these symptoms.
Yes, sir.
Liver patient, you can see these symptoms.
Hmm.
Hmm? Heart patient, you can see these symptoms.
Hmm.
Spleen patients, you can see these symptoms.
Yeah.
Hmm. So, which organ is actually responsible? We have to check. You can check by the your tool, 5-element tool, and
Hmm.
you can check by this pathological tool.
Okay.
But your tool is more better because pathological tool will find out the cause after the biochemical changes in the cell, in the blood.
Yes.
Hmm? So before the biochemical changes in the blood, in the incubation period, how you can find out?
Hmm.
Hmm? In that period, your 5-element theory will very helpful.
Yes.
In that period, our 5-element theory is very useful. Na? Immediately, within a second, your mood change, taste craving change. Hmm? No pathology can find out it easily.
Hmm.
Because of the medical science, we are giving all types of the information and all type of the knowledge. Okay, for the confirmation, actually, today the more believe on the this chemical study of the blood, na?
Hmm.
So that's why we are taking support of these tools also.
Okay.
For example, if there is a hypoxia patient, what you will do? If a patient came to my
Hmm.
emergency, hmm,
Hmm.
and
Hmm.
oxygen level is low,
Okay.
patient is in hypoxia, what I will do? First, I will check the hemoglobin.
Hmm.
Hmm. If the hemoglobin level is low,
Hmm.
then I will check the cause of the hemoglobin low. Just I'm telling you the allopathic style. Okay.
Okay.
First,
Okay.
HB check. Sir, HB low. Okay. Next, do the LFT and KFT. Okay.
Hmm.
So means the hemoglobin low is because of the uh, liver function or because of the
Kidney.
kidney function. Okay. And we will or ask to the patient if there is any blood loss. It may be sometime piles or sometime post delivery or menstrual during the menstrual period blood loss. Patient says, sir, no blood loss history. Okay.
Hmm.
Then we will go to the liver or kidney.
Hmm.
Hmm. So we will find that problem is liver or problem is in the kidney. If problem is in the
Hmm.
liver, we will treat to the liver. If problem is in the kidney, we will treat to the kidney.
Yes, sir.
If patient says, sorry, pathology says, sir, hemoglobin is normal. Then our test stop. We will not go to the liver or kidney. What we will do in that condition? Okay, X-ray chest. Simple. Okay, because hemoglobin is normal, means liver or kidney will be normal. So we will go to the further investigation of the chest. We will advise to X-ray chest. Maybe TB or maybe some other fibrosis or any chest related issue. So we are trying to find out the root cause by using this our modern tools. You can easily find out these tools very easily. The tools, 5-element tools. And daily, I am observing just in the starting phase of this today class. One patient came to me and he told me all the their history. Okay, and in the end, as per the history, that patient earth element was very hyper. And in the end, what he told me, sir, I can't listen the name of sugar. After listening the name of the sweet, I am feeling light vomiting. Means the most disliked test is sweet. So my diagnosis is very clear now. I was already thinking about the hyperfunction of the earth, hyper earth, but he justify my thoughts.
Yes, sir.
So we have a very good tool. Okay. But if you want for the confirmation test, you can go. Sometimes patient test craving is salt. As per our concept, the kidney energy is low. But when we check pathologically, blood urea, EGFR, and creatinine level is normal. Means this period is incubation period. After 15 days or 1 month, there will be some biochemical level will be changed.
Okay.
For that period, our diagnosis is very useful for the patient.
Thank you.
In allopathic treatment also, you are trying to find out the root cause. Some people say that no, sir, they are giving the medicine on the symptoms level. No, they already try to find out the cause. Just I give you example of the hypoxia case. No? If the patient oxygen level is low, they will start the oxygen, but try to find out the cause. What is the real cause behind this hypoxia?
Yes, sir.
Same, you can easily use this your 5-element concept or other things. Yesterday, I advised to Dr. Shams that actually there are maximum patients in an ICU. There are only 2 diseases, 2 or 3 diseases. One is the low lungs development patient. Kids, lungs is not developed in uterus. Okay, so mostly they put this kind of patient on the ventilator.
Okay.
So here, some have 3 ventilators. Some has a very big NICU, near about 40 plus warmer in his NICU. Very big
Okay.
setup. Okay, and second problem is the hypoxia. After birth, child is not crying. If child is not crying, it's the hypoxia. And
Okay.
third case is the renal function failure case. yesterday I advised him, okay, for all the lungs related patient, you are what antibiotics you are advising, no problem, okay. But my suggestion is this: please change the antibiotic, and you um, advise for the antibiotic which is the good for the large intestine, metronidazole, tinidazole, or any this. So he says me, so, okay, I will try this formula, and now he will do this, and after 1 week or 10 days, I will ask what is the changes. So, as per our theory, I think that for the lungs patient, maximum lungs patient, large intestine is disturbed.
Mm,
They are not thinking about this.
mm.
If he is treating in allopathy, or if you treat large intestine, he can get good results. It's my hypothesis
For the lung symptoms. Yes, sir.
for the lungs, lungs development.
Mm,
80% lung develop, 40% lung develop.
mm,
Only 2 or 3 disease patient in NICU, na?
mm.
He will try this. He will give me feedback within a week.
Share it with us, sir. It will be a good observation.
So, Balakrishna sir,